Hit record. Okay. All right. Hi, Max. So great to see you
Hey,
face to face
hello,
again.
Pam. Good to see you. I'm glad we have the Zoom video so that I can see your lovely face.
Back at you. I miss seeing you at conferences. You know that?
Yeah, I do too. I'm ready to go to a conference. Yeah, and you want to go to a good doctor conference sometime, let me know. I'll meet you there.
Absolutely. So you know what? I'd like to kick off this podcast and just saying thank you to some of you listeners that have reached out to us and given us feedback about what has been helpful in our content. It's really helpful to help us decide what to talk about next because this is all about you. And I want to also acknowledge the fact that while we're not treating you here or may not be able to specifically tell you what direction to take, I'd love to be able to do that. We'd love to do that. But of course, we can't do that without actually physically seeing you for an exam of some sort. But the hope with this podcast, again, is just to again, open up, let you guys start thinking about how your symptoms may be a TMD issue, and then also for other doctors and health professionals to start diagnosing and looking at people correctly. So thank you, and please continue to reach out to us so you can help guide us with regards to what content to put out next. Today, I think we wanted to talk about TMD diagnosis and the treatment and why is it so expensive? Because that is something that I get a lot from the patients coming in. I don't know about you, Mac, when you were treating patients, what was your experience?
Oh, yes. It's the expense is overwhelming for a lot of people. And it was not so much overwhelming, it is a sticker shock. They just can't imagine that it would cost so much. So this podcast is called Open Up because we're opening up to what's true. And so we got to talk about money. And in my book and with my patients, we made it very clear to the patients that your headache pain is one issue. It's a very, 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 very important issue to you, to us, and to everybody involved. Money is another issue. And it needs to be discussed with the same frankness as we're discussing your pain. So let's set aside the money for now and let's talk about your pain because we've said many times that the only way we can diagnose if we have it hands-on. So let's talk about, I want to hear your story. I want to do a diagnosis. I want to do a treatment plan. And then we will talk about money and talk about it very candidly. So I know you got a copy of the unpublished book, and we have a whole chapter in there about that issue. What was your feeling? What was your opinion? What was your experience of what you read in that book that you could relate to in your own practice?
Um, Everybody thinks, why is it so expensive? TMJ treatment in our office can cost starting at a couple $1,000s to $26,000 from start to finish, and it can be upwards of 2 to 3 year process. With that being said, I've in 20 years of treating TMD, I have yet to meet a single patient after treatment that said that was really expensive.
It was 100%.
I don't think, at the risk of sounding vulgar, but we're going to be open about everything. I don't think we charge enough because the amount of time, and the reason why I think patients feel this way is because of the amount of time we spend with each patient. It is multiple visits. Temporal mandibular disorder is not typically an acute condition, meaning once in a while you might suffer an accident and it's a quick and fixable situation, so it's not that expensive. But typically, this is a chronic condition that started when our faces were developing and has led on and on and on through decades of life. So anybody who's claiming that they can, quote, fix the problem within a month or two, I would be very weary of that. I don't think that's humanly possible. I really don't. So in that chapter, I thought you did a really brilliant job of breaking down expense. And same thing goes with our orthotic treatments. I've never had anyone say, wow, I wish I never spent that money. They're like years later, they're like, I still have it. it's the best money I've ever spent. And what
Right.
you did is you broke down, okay, at that time, I think you quoted like you're charging $4,000 for a specific type of orthotic because they're different ones, right? And then that patient who came back years and years later, they're like, oh my God, I thought it was like so expensive, but it wasn't. And then you actually sit there and as a fun thing, did the math chair side, and you're like, it ended up costing him less than $1 a day to get
Right.
him out of chronic pain that he's
Right. 100%. 100%. And then everybody, thinks that surgery is an answer. The lay public thinks surgery is an answer. And you and I know that surgery is absolutely the last thing that you want to do. So
right.
how much is surgery going to cost when you go in and you're in the hospital, you're general anesthesia, et cetera, et cetera, et cetera? Of course, insurance pays for a lot of that, and it doesn't pay anything for TMD that I know of in my experience.
So you just hit two triggers for me big time.
Big
Okay.
time. Those are still, we're opening up. So let's
Well,
discuss it.
can we like talk about the fact that why don't patients say, oh my God, like I just had surgery. I don't sit there and say, oh my God, my hospital expense was thousands of dollars. My orthopedic surgeon who spent 1 hour with me was spent thousands of
Right.
dollars. Nobody talks about that because why?
Well,
Because insurance picks up a good portion of that. So is it like the dental doctor that treats TMD, the one that should be being paid less for that training and knowledge and time they put into it? Or is this really an insurance problem that they're not acknowledging the fact that people suffer from this condition? Or the fact that they're willing to pay for medications, but not to fix the problem. They can band-aid the problem, but they're not going to help you fix the problem. To me, this should be an awareness within the insurance community of some sort, recognizing that these people do suffer from a legitimate condition, and they should have some kind of compensation back towards them to be able to afford this. Because you and I never want to see these patients in pain. But as you also wrote in your book, it sometimes is out of their budget, and we get that.
absolutely.
We don't
They just
shame
can't afford it.
people. They're coming to us looking for answers, and we think it's the TMD issues. We have the science and technology to back that. But sometimes they're like, so you're telling, you said in the book, so you're telling me to get rid of my headaches. It's going to cost me $8,000, or I can decide to live with my headaches and save $8,000. And that patient said to you, I think I'd rather save my money and live with the headaches. That's quite all right. That's okay.
Perfect.
I get that. You get that. It was never shaming and finger pointing. Or sometimes patients say, I'd rather just do the Botox. Okay. But understand what that also means. So we're here to provide a certain service. And it's just a travesty that insurance is not willing to pick any of that up. But does that mean that we should, I mean, we spend a lot of time in education and invest in our teams and the technology that goes into it. I mean, it is that's part of the process. There has to be some kind of compensation so we can afford to keep doing that.
So the medical model now is get them in and get them out. We all know that to be true. Anybody listening to this knows that that is the medical model that stands for today. As I've said in another podcast, you're not the problem, pain sufferer. You have a problem. And the problem that you have takes very special skills, not only in knowledge, but ability and in caring. That's not get them in and get them out. It
Mhm.
takes a long time to peel the onion on a TMD patient because there's so many factors that are involved. There's muscles, there's joints, there's injury, there's trauma, there's all kinds of things that are involved that are all part of each and every one of your story, and that story needs to be heard. And that story can't be heard if you are on roller skates as a physician or a dentist and you're running from one room to another room. So you're right, Pam, it takes time, and time is money. And that's what you're paying for, and the skill. And when you are at, what is the value of being out of pain? Can you be in pain and work? What does it do to your career? I mean, I don't have TMD pain, but when I was young, I had hangovers, and I know good and well that I can't bend over and look in a mouth with a hangover. So if you got TMD pain, I can't imagine you trying to get through the day, especially in work or in social events or family events. And so what is the cost of feeling good?
So, again, it reminds me of a story of this patient that drove down from Pennsylvania for treatment. He has a roofing company and he is part of a religious society that doesn't do a whole lot of medicinal treatment. So anyway, he suffered a fall. He fell off a roof. And that triggered this horrendous vertigo situation. So is it the accident that caused the vertigo, or was it the accident that kind of spilled over that already filling cup of symptoms that was below the radar until something triggered it, right? So he had been to everyone under the sun, including NIH, that said that his condition was not treatable. And he has, I think, 4 children, and the only one that worked, his wife doesn't work. And he's like, how am I going to take care of my family? Because I can't get back on the roof. I can't function in life because I'm having daily vertigo issues. So, we did our workup, did our 3D scan, looked at the muscles, and I said, I really think that this vertigo issue has been probably under the radar this whole time, an underlying condition that just got triggered from the fall. And I think I may be able to treat you. So I treated him just initially with an orthotic, and he and his wife both came at that first appointment. They're like, this is too expensive. I don't know if I can afford this. And he's young and his teeth are ground down, like he's in his mid-30s. Like his lower incisors are about half the size. And I'm like, and he's like, and now I have to wear this thing in my mouth for the rest of my life, or I'm gonna go back to having dizzy spells. I said, probably, or you do braces. He's like, okay, let me just try this first. And they were willing and they tried it. And his vertigo has been at bay, no problems. He chose never to do orthodontic treatment or restorative treatment to get his teeth in a balanced position. He wanted to keep that orthotic to keep him balanced. So over the years now, as the orthotic wears down because it's softer than the teeth, he comes back for relines or new orthotics, never ever complains about cost, the 4-hour drive he has down, none of the above. He's just so grateful and says every time I see him for I think I see him every 4 months or 3 months for just follow up, see how he's doing. He's like, I can't believe that I would have lost everything if I didn't find you and was willing to do that. So I can't say if $8, 800, 8,000 or $80,000 is too expensive. That's not for me to say. But like you, any patient that comes in our office, I've created the environment that I have the time to spend with that patient. My team knows how to handle that patient. The equipment's there to be able to support the treatment and the diagnosis. And all of that takes time and money on our end.
And then you go back to your hospital example where they go in and have the hospital and then also the surgery. So it's broken up in two different parts. The hospital, which is all the equipment and all the staff and all the other things. And then you have the surgeon's fee, which is just that one specialty. The amount of equipment that you and I have to have is very expensive. And we are a business. Dentistry is a business. And if you don't make money, you can't help patients. You can't do anything.
Right.
So you sometimes money is a real serious issue. And I don't have any answers for you other than teeth apart, lips together, try to relax, try to get help from somebody else. But it still goes back to the teeth being the problem. And only very experienced, very educated. I mean, how much money did it cost you to get educated to treat TMD pain and to do what you do? It's incalculable.
Right. And
And
ongoing.
so, and I know that's our side of the story as doctors, and we make all this money. I hear that, I understand that, but it's also reality. That hospital is reality. That surgeon's fee is reality. The insurance pays for that. That's reality. Insurance doesn't pay for us. That's reality.
Right.
And when you have this problem, you've got to face reality. I mean, you can't keep living your life like this with being in pain. And either you're gonna do it yourself and relax the muscles and keep that joint off the back of the socket, or you're gonna have to get some help from people like Pam.
So it's like for our listeners, there are different ways to manage it. The most important thing that Mac and I are trying to do is to let you guys know that there is after all the doctors you've been to, a lot of times you guys are convinced that there's an undiagnosed tumor in your head, or that
Yeah.
you're flat out crazy. And if you're married or you have a job or a kid, they don't even want to be around you because you complain all the time, or you're miserable, or you need to go shut yourself in a room because you're suffering from a migraine for hours on end. We want you to know that there is a condition that you're suffering from. There's nothing crazy about it. And if all the other scary things have been ruled out, that you're not crazy. Okay. That's one of the main goals for us, is to let you create that awareness, to open up that thought. The other thing is that when Mac was working, and I still do to this day, if someone can't afford my treatment, I'm going to help them kind of navigate what other direction to go. Maybe it's Botox, maybe it's physical therapy, maybe it's massage. And there's no wrong answer or right answer to this. But I want you to know, if it's TMD, how you can kind of manage it until you budget to come in and have real treatment done to have it corrected. Now, what does frustrate me are the patients that come in, they're like, I can't afford it. And then they talk about they're going to go to X, Y, and Z vacation. Well, then to me, that is your choice. That is your life. And you're deciding to do that instead of getting you out of pain. And there's nothing wrong with that. But there's only so many patients I can see. There's only 24 hours in every day. And the people that want treatment from us, me and my team, those are the people that I can spend my time with. We do this podcast. It's not monetized. We're doing it because, again, we're just trying to get good content and information out there.
And then go back to podcast one. This is kind of fits in with the do-it-yourself segment in my book, what you've read. So if people listening will put their fingers in front of their ears and move, they'll feel the joint like we discussed in podcast one. And if there's pain there, that's because the joint is being compressed. So how do you decompress without the help of Pam or without the help of Mac? You slightly let your jaw come forward so it's not being pushed back into the socket. Then you have the muscles that are in pain because they're being overactive. They can't find a very comfortable spot. That only occurs when the teeth touch. So the answer is, for do it yourself, don't let the teeth touch.
Right.
Sounds easy, but it's hard to do. Put lips together, teeth apart, tongue and roof of the mouth, chill, know that stress plays a huge part in all of this. So both you and I hear all the time, I used to have TMD until I got a new job or got a new spouse or whatever it might be. So yeah, that's the reality of this
Right.
condition. And it is a condition, it's a real condition. And we've got it figured out a lot more than the MDs got fibromyalgia figured out.
Right.
Because no one really can put their finger on what fibromyalgia is. You and I can put our finger on TMD. We
Mhm.
can teach you, and you read my book, and teach you to put your finger on your TMD. So that somebody, when you're getting help and when you're getting the runaround or you're getting kicked down the road.
Right.
So we got a lot of work to do.
Yep. Just as we wrap it up, I want to emphasize what you just said. Not only is TMD a true anatomic issue, but it's also a psychosocial issue, and things can get you triggered at different points in your life. Stress, anxiety, hormones, different things can get you triggered. But it's about understanding, what's causing the triggers.
For sure.
All right,
All
friend.
right. Let's
Awesome.
keep it up.
Let's keep it up until next time. All right.
Next time, dear.
All right, bye, Mac. Bye, y'all. Okay. So what do you think, Anna? I felt like you got bored.
No, 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 no. I was just when I go, like, I try picturing like scenarios that we've gone, like we've dealt with in the past, patients, money. And
Yeah.
they ask, and it's true, it's like $1,000, but it should be so much more than that.
Yeah, it should be.
Because
I hope I think that was important for us to do,
People
Matt.
needed to hear that. People need
Oh,
to
yeah.
know why.
I mean, it's the elephant in the
It's a
room.
reality, like Max said, it's the reality of things. When you go to a hospital and you get a surgery, it costs you $30,000.